Good afternoon, everybody. How you doing? My name is Carter Todd. I'm president of the Capital City Black Nurses Association. Thank you for tuning into our Barbershop Health Talks, the season 2. It's our first installment here on June 23rd. As we get going, I just want to give a big shout out to Aaron King, who's going to be running our StreamYard in the background. Y'all might have seen him on the news yesterday talking about this program and some of the other great things that we have going on at Capital City Black Nurses Association. So the plan for today over the next hour is going to premiere our first episode of 2022, where we're talking about gun violence, not just here in the Sacramento region, but across the nation. We've invited some very astute guests. We have Dr. Ian Brown, Dr. Italo Brown that's going to be jumping on as well, and then Aaron will be on after the video to watch. So we're going to run it for about 25, 30 minutes. Dive in there. There's going to be a lot of great content, a lot of great men speaking over here on the West Coast, and then we'll do a live Q&A after. So stay here on any platform that you're viewing, and you get a chance to type in your questions, hear us go back and forth, and just dialogue about this epidemic that's been rampant in our community for a long time. So this Barbershop Health program is brought to you by Capital City Black Nurses Association. We'll give a shout out to our sponsors throughout the video. Thank you for all the support for everyone that's been with us since the beginning. Gun violence is the first installment of this time, but we were thinking about doing this, and this was in response to the massacre that happened downtown here in Sacramento on April 3rd. And it's just something that I presented on many times. That's impacted our lives very personally. And from a nursing perspective, we know how important this is to do whatever we can to talk about gun violence and try to stamp it out the best that we can. We know that every year there's 60,000 people are injured by guns and gun violence, right? And we know that every day 88 people are dying as a result of a gun violence. So it's a very real issue in our country, not just now, not just this last year, but it's been a big issue for a long, long time. So stay tuned. We're going to start the episode now. So it runs for about 25, 30 minutes. Check it out. We have our links code in the top right. Give us some feedback towards the end of the program if you like this platform, if you think we did a decent job, what we can work on. And then you'll see us back on in about 25, 30 minutes.
What's up, everybody? Carter Todd, President, Capital City Black Nurses Association. Thank you for tuning in to our Barbershop Health Talks, first installment of 2022. We had a great start last year. This year, we look to bring 3 of the programs here from Sacramento, from Chicago, and all over the country, talking about Black men's health, lifting up the barbershop as a venue of cultural influence. We're really excited to be working with a lot of our partners here. As we get going, I want to give a shout out to some of our sponsors, UC Davis Health, Betty Irene Moore School of Nursing. I also like to recognize some of our partners here. We're an exclusive barbershop studio downtown here, Oak Park community. Thank you to Javier for allowing us this back room. Also, we've been working with our trap medicine compadres, working with I Am Health Impact, My Brother's Keeper Sacramento, and also our Brother Be Well platform that we've been consulting with over the last couple of years. Really happy to be working with them to bring mental health resources for boys and men of color. As we talk about gun violence today for this installment, we'll really talk about how important the mental health aspect is of the fallout of this. So stay tuned with us. We have some great speakers lined up for you today. We have physicians, we have nurses, we have mental health practitioners, we have community members here to talk about what gun violence really does to us here in this community and ways to move forward. That's what I'm really excited about, is how do we continue to move forward so when these acts of violence happen, we're better prepared and to not let them happen again. Our first speaker today is going to be Dr. Ian Brown. He's going to be talking to us about the clinical aspect of gun violence and trauma-informed care. He works here in the Sacramento community, someone that I respect, that I've seen in the hospital working, and he's going to talk to us a lot about violent acts, and I'm excited to hear a little bit about what he has to offer.
Okay, my name is Ian Brown. I'm a trauma surgeon, trauma critical care. I work at University of California, Davis, which is right down the street here, so part of the community. My background, I grew up in Chicago, kind of Chicago area, and Maywood is a little suburb just right outside Chicago. That's where I'm from, and made my way out west, got my undergrad at Stanford and went back home to Chicago, University of Chicago, did an MD, PhD there, came back out west to San Francisco, UCSF, trained to be a surgeon, and then made my way out here to Davis to do some critical care and trauma surgery.
Yeah. And I remember meeting Dr. Brown for the first time. He might not remember, but we had a patient, a gunshot victim over in the pediatric ICU probably about 4 or 5 years ago. So thank you for being here. Can you tell us a little bit about your wraparound program and some of your experience working with gun violence in the community?
Absolutely. So maybe about 5 years ago, we reinstituted a program that we call Wraparound. And so what that is that historically, when someone come into the hospital and they got shot or stabbed or injured in some sort of violent trauma, we would do the best we could to patch up the holes, get people back health-wise, and get them back, get them out of the hospital. That's sort of the old school, I guess, the derogatory way to say it would be treat them and street them, more or less. That's not enough. So it turns out that if you experience violent trauma, the rate of recidivism, or the chance that you're going to have another additional episode of violence-related trauma, can be as high as 40% in many communities. Wow. And so what we're doing is we're putting people back out that we've already identified as being at high risk for violence to the same situation that they started off with that predisposed them to violence. And in addition to that, like, they've already had violence, so they're scarred now, and so it's even worse in some ways. And so we have this program that more holistically treats a patient and addresses some of those social determinants that predispose somebody to violence, so that we can decrease those numbers and help people kind of go in a different direction. You might think of it this way. So if a person had a heart attack, they'd come into the hospital, and not only would they get their heart vessels opened up, but they would be put on a program that addressed their whole lifestyle, what they eat, how they exercise, all sorts of things like that, because they're already at risk for a heart attack. So now you're doing preventative stuff that addresses all the aspects of life that put them at risk. Well, you can do the same with violence. You can take a public health approach on an individual basis and address all those same life issues and help people and empower people to get to where they want to be, so that they're not at risk in the same way anymore.
Yeah, it's a great program. And before this, we were talking about some of the numbers of how many people do you see come through the hospital? What was that statistic you said daily? Was it roughly 2 a day?
Yeah, roughly 2 a day. So we see probably about 800 overall cases of violence-related trauma a year, not including child abuse, non-accidental trauma, stuff like that. So it's a pretty high number. You can imagine that, if 40% of those patients are coming back, that's 320. That's almost 1 a day coming back.
Yeah.
And so I think that, that's a huge number.
Yeah.
Unfortunately.
So it sounds like you're doing a lot clinically. That's your expertise. You've trained a long time to be here, so we appreciate you. If you were to give a word to the community about kind of how to get through it, how do we move past these violent acts, what are some words of wisdom that you might instill on folks?
Oh, I probably would take a couple. So one thing is about sort of the culture of healing. And this is one thing that the Wraparound program is built upon. It's cultural competency, understanding, and approaching people with a shared lived experience in a way that really reaches people that wasn't historically taken into account. So we're getting a lot better at that. And we're sort of attacking it from the inside too, because when you start to address the patients with that, the Wraparound program not only addresses the clients, but it also changes the way the hospital system looks at violence-related trauma, and has changed the culture around how we receive patients and what their hospital's experience is, and then what their post-discharge experience is.
Sure.
And so I think that that's critical. I think you have to start with a very humanistic approach. On the medical side, you'll see people sometimes say, oh, we're treating a gunshot wound. But you're not. You're treating a person who has a gunshot wound. And so it starts sort of within in that mindset and that culture change. And I think that that's been big. And I think that works not only in the hospital system, but also in the community. I think we have to realize how in touch we are and how much we see ourselves and our family in violence-related trauma, and how, we're connected. We're part of a community. It's not we're treating the people over there. It's our community, and we have to own it. And we have to decide what our attitudes are towards that. And we have to take an active approach towards healing. That's a real holistic approach. I think that we have to eliminate stigma, issues. The mental health aspects post-traumatic experience are very real and only starting to be addressed in a way that is adequate.
Yeah.
And so I think that we're making positive moves in that regard.
I'm glad you bring up the mental health side of it. We have some speakers a little bit later who are going to be touching on that part. And you talked about the impact in the community, the ripple effect from, the tragedy on April 21st. It was felt nationwide, right? The focus on Sacramento. But these violent acts happen all the time. Gun violence is something that, our communities have to live with, that we need to work through and improve in any way that we can. So I appreciate Dr. Brown for being here. I'm gonna let y'all know his wife is a nurse, so he's very tapped in with Capital City Black Nurses Association.
Absolutely.
Yeah. So thank you for your time, man. I appreciate it.
Absolutely. Thank you for having me over here.
All right.
Appreciate you.
Our next speaker today is going to be community member Ryan Banks. He's a local Mr. Everything here in Sacramento, part of the night scene, part of the party scene, and really just an engaged community member, a beacon of positivity through some of these tragic events here in Sacramento. So next up, we're going to hear some words from Mr. Ryan Banks. Tell us a little bit about yourself.
Like the gentleman said, my name is Ryan Banks. I've been living here in Sacramento since I was about 19 years old. I've been here for a while. I've always been active in the community. I've worked here in Oak Park at St. Paul for several events they had there. I've done toy drives. I've been really hands-on in the community whenever time permits. So a little bit about myself. I'm the general manager of London, Sacramento. Unfortunately, we were a block away from the last incident that just occurred 3 weeks ago. It's been a trying time.
Yeah.
So, yeah.
And I reached out to Ryan. I'd seen him through his IG handle, which he'll touch on a little bit later. But I was just really respected the way that he was moving initially, during, and after, right? Because these traumatic events, it needs a call for the community to come together and be a resource for folks. And I say it all the time through Capital City Black Nurses is that, we are the help. We're here to help people get through things. And when these horrible incidences occur, ultimately it does fall on those in the community to lift us up and get through it. So
Definitely.
Can you tell us a bit about on April 21st, kind of what that night was like for you and the days following?
So the night it happened, we were on a consecutive run of being sold out for about 2 months straight. When I say sold out, I mean like we're hitting max capacity by 11. We're having great nights, really showing the city that we people of color can come together, party, and have a good time and be safe about it. That night, I left right when we turned our lights on. We turned our lights on at exactly 1:19 a.m. 1:19 a.m. I left. I spoke to a couple of people. Actually, one of the victims who passed. I spoke to him right before I left, and I was leaving early that night because we were actually preparing for a brunch the next morning.
Gotcha.
So I had to be there the very next morning, and so by the time I got home, it was about 30 minutes later. Right when I, you taking your clothes off to get undressed, I got a phone call like, hey, after we closed, we heard gunshots outside, just not regular gunshots, like a lot of gunshots.
Yeah.
So, I started getting dressed, getting ready to go back down there. And as I pull up, the police had the entire, you couldn't get nowhere close to it. So just the moments after that, I'm calling, checking on staff. Several of my friends were around the corner several of like my best friends were like around the corner from the incident when it happened. They were sheltering in place because, it was active shooter. It's just the fear of the unknown. You don't know what's going on. You don't know if someone left their phone on the charger. I have a staff of 27 at the club. So it's like checking in with 27 different people, making sure everyone's accounted for, making sure everyone's okay. Then that's when you start hearing that, oh, it's fatalities outside. Now it's like, I work outside of the club every weekend. So I see everybody who's out, all the regulars, even the homeless lady who ended up getting killed. She was our resident homeless lady, you know what I mean? So like just finding out those things is, it's such a tragedy because it's like, how do we avoid these things from happening if we can't even have a good time in our own city, and be safe? So.
And I appreciate you being able to open up about it because it's not easy, man. I can tell you're a leader in the community. You carry a lot on your shoulders, but to be able to unhash that trauma, it's a challenge. And we have people here that you can tap in with if you need any follow-up talks or discussions. So with that being said, I seen a lot of the way you were moving and being a resource and a beacon of positivity after, right? And I think a lot of people look to you for that. So what were some of the things that you implemented or some of the other programs or resources that were helping you either then and now to get through it?
Well, the first thing, you know, after I checked, make sure everyone was safe, and then, you know, you're going through all these things. I reached out to a few of my friends who are one of them in particular, her name's Jennifer Baker. She has her own private practice. She's a therapist, and she was like, "Hey, you know, anyone personally affected by it, you know, reach out to me and send them my way, and I'll take care of it." So her and her office was able to, I believe we sent them about 12 people who were directly affected from the tragedy. You know, I want to say thank you to them and their practice as well, because, you know, I feel like majority of the people in our community don't know how to open up and trust and talk to someone, you know, and hash out, you know, these types of traumas. And it was literally like when I first posted about it, it kind of blew my mind how many people actually reached out to me.
Yeah, there was love on there.
There was a lot of love. Like so many people retweeted it or reposted it, and then me personally reaching out to the people I knew who were affected by it, and actually being able to tell them, hey, like this is me talking to you. Like you can trust me when I tell you, like it's okay to go and get help. So, you know, just building up those relationships on top of the previous relationships I already had with them was just the beauty and the tragedy type thing. You know, so.
Yeah, that's solid, man. And, you know, Capital City Black Nurses, we've been partnered with Brother Be Well Project, you know, mental health resources for boys, men of color, teenagers into adolescents. It'd be a perfect conduit of resources for folks for like right now.
Yeah.
Any last words you'd like to give us around gun violence or moving forward? Kind of what do you hope to see? You know, obviously nothing like this to ever happen again, but y'all are back outside.
Yeah.
I think that's great, you know, to move past it, to not let this hold you down.
Yeah.
But where's moving forward?
Words moving forward, I would just say that, you know, if you feel like leaving your home, you're going to do something that you may regret, that may take you away from your family, just don't do it. At the end of the day, you know, it was, I just went to one of the funerals yesterday, and just to see how many people that one death affected, it really rocked me to my core. So moving forward, I would just say that if you're not prepared for those type of life choices, just stay home. Stay home, figure it out, talk to someone, and find a different path, because this isn't it, and we need to do better.
Ryan Bakes, I appreciate you, bro. Thanks for pulling up on a Saturday. Busy man, giving back to the community. Next up, we'll have our next participant. So again, this was Carter Todd, Capital City Black Nurses Association, Sacramento chapter of the National Black Nurses Association. We do invite you to scan the QR code in the bottom right side of the screen, fill out the survey, let us know how we did, let us know the ways that we can improve, and really continue to bring these resources installments via the Barbershop Health Talks. Like I said, this is the first of many installments this year. We look forward to working with our partners, Trap Medicine, My Brother's Keeper Sacramento, the Brother Be Well platform over the next year. We'll be taking this platform out to Chicago in July. So stay tuned with us. Follow us on our Instagram, our Facebook, our LinkedIn, and we'll be premiering this video here shortly. Travis Nelson is our next guest, a marriage family therapist here in Sacramento, California. He's really engaged with the community. He's been excited to jump on our platform here with the Barbershop Health Talks. He'll be talking about the mental health aspects of gun violence and the fallout. So with no further ado, I'll let you introduce yourself.
All right. Thank you very much, Carter. Thanks for having me, man. Appreciate you. This is a rare opportunity. I think we all should take advantage of this opportunity to have this platform to talk about these things. So my name is Travis Nelson. I'm a father of two boys, 23 and 21 years old. And they went to school here in the Sacramento neighborhood, Sacramento High, as a matter of fact. I'm going to put names out there, but very successfully graduated. But they've lost about 7 friends to gun violence in the span of maybe 3 to 4 years. They weren't in gangs themselves, but their friends, you know, of course, are from the area. So my fear was that they would get caught up in that movement. So the trauma that, even with my sons being present with me there, I saw how it affected my youngest, especially where he saw more gun violence. I'm also a retired Army captain. So, and I've been in Iraq and fought in the Iraq War. But I think my son has seen more gun violence going to Sacramento High in Oak Park, Sacramento, unfortunately, right now. So that has motivated me to speak out as many opportunities as I can. I'm also a mental health professional. So I've worked everywhere, to include a psychiatric facility. But what I wanted to talk today and share with us today is about, it's not just gun violence is an outcome, it's a byproduct, I think, of a bigger issue. The bigger issue, I believe, is definitely about what happens at home. So there's a theory out that's been researched and empirically researched and proven to be true about how we develop these core beliefs based on our experiences growing up. How does a barber learn to be a barber? Another barber teaches him. How does who was the first doctor? I don't know, but somebody had to teach somebody.
Yeah, see one, each one, teach one. What's the saying?
Reach one, teach one. But that's yeah. Absolutely, man. So the research shows that we develop these ideas of what a belief, a core belief or core value. And that means what we believe to be true about the world around us. And that means our political views, our religious views, how we should engage with each other, what a healthy relationship looks like, because there's no model right now of what an actual relationship should exactly look like, because there's no two people on this planet that are just alike. So what works for one family or relationship may or may not work for another relationship, because you have two different individuals. But then the research also shows that we pick up different beliefs and values from what we're exposed to in society, right? You talk about Instagram, you talk about if you're raised in the streets violence. I lived in East Oakland, but mom put us in private school in Berkeley, so, and try to keep us away from that. But all that to say, though, there is no standard. We even had a model on social media that we all looked up to. Those Black families we saw on TV were so rare and so strong, and then we find out in real life these people are just human as us, as you and me. So it's all about what we teach our kids is what they emulate. So what are we teaching them, right? And where did we learn that lesson from? What we're teaching, where did we get our own core values and beliefs from? Are they cultural? Are they spiritually led? Are they led by, if you're in the streets, is it to survive, right? I saw there's those little fish bowls they have at the fair with the little the kids can win for a prize, little goldfish bowls, right? Little clear bowl, maybe some crystal blue rocks, a little 2-story green castle in there, little pretty fish. The kid takes it home, puts it on the shelf, swims around, it gets fed, water's changed, years and years. This fish swims in this beautiful scenery. Now, suppose this fish wants to engage with another fish in a different fish bowl, right? That could be a wife, that could be a brother, that could be enemy or friend. And say, hey man, don't you love how the water glistens off these green castles? And the other fish says, man, castles are blue. What are you talking about? I've been swimming around years. My castle's blue. No, man, castles are green. No, bro. Castles are blue. Man, I'm on the second floor looking out the window. The mermaid tells me how good the water looks on my green castle. The other fish says, man, what's a mermaid? I know what a turtle is, but I don't know what a mermaid is. So we all engage with each other from these different belief systems that we grew up with and we were exposed to all those years. Now imagine them taking them out of those fish bowls and putting those two fish with green castles and blue castles all their lives, and they're arguing about which color castles are, and they put them in the fish tank where there's other fish from other fish bowls with other experience. And ain't no castles at all. Now there's a whole mountain scenery, right? Right. And then, let's take them out and put them into a lake or a river or a stream. Or how about one of our oceans where there's all these different fishes from different experiences that we try to engage with based on what we believe to be true. Conflict usually comes when we misinterpret other people's behaviors. And the research shows that we misinterpret those behaviors based on what we believe to be true. A Christian seeing somebody going into a club might think differently than somebody that's not a Christian seeing somebody going into the club. But the statistics shows that in 2020 that there has been a significant decrease or increase of people that were raised by either a single parent. That the statistics, and according to the Census Bureau, says that there's since 1968, there's been an increase 75% from 80% of kids growing up with mom and dad down to 75%.
And that's going to really alter that core belief system,
What lessons are they learning?
And like you talked about the formidable years, so high school, middle school, young men are becoming themselves, and the testosterone starts flowing.
Right.
It's really important that we instill, good habits, good thought processes, and good visions of who a positive, successful man in the community is. And that's what we really look forward to at Capital City Black Nurses, and just highlighting all the different avenues that men can grow up and be really positive in the community, right? A barber, photographer, mental health professional, obviously nurses, physicians, but just creating that positive kind of role model that we all really need, and that really helps people with that foundation. Before we leave, I appreciate the insight. That was really good. Anything that you want to talk about, or resources for people moving forward to work through gun violence with your history in the Army? We talked about the PTSD, but for those impacted, the gentleman earlier said that he just went to one of the funerals yesterday from the tragedy. What can people do as a mental health resource moving forward?
Okay, so the county, the state, the government pays for programs to support people with needs like that. The county has a bunch of resources. If they can't provide the resources for you directly, with insurance and without insurance, there is something available for you. But just like, you hear about Alcoholics Anonymous, the first step is to admit that there's an issue.
Sure.
And that's where we come in short in the Black community, especially. We learn to just go and thug through this and get through this and make it the best way we can. But, we're only human. And when you're happy, what do? You smile. When you're sad, what do? You frown. When you're stressed, what do? You go through it. It affects you physically.
Definitely.
It affects you emotionally. So resources are continue to look into your government resources. That includes with the county. There's a couple of websites. I'm not here to advocate for any certain one, but there's a big one named Psychology Today that a lot of people use, right?
You're the expert, right? If you endorse it, a lot of our folks, we're looking for trusted voices, and that's what's really awesome about this platform is that you're getting information from people in the community. We're just regular cats that want to come together and make a positive change in the community, and that's what I really appreciate that.
Absolutely. My mentor in the mental health field is a Black female named Dr. Takla. And she's from East Oakland, and she's a doctor and has a couple of licenses, and very, very known. And I, there's not that many mental health workers, Black of color, let alone male mental health workers of color. So anything I can do to help make that different, and I appreciate the Black Nurse Association. And I think we've had some good conversations about this.
We'll be working together.
Absolutely. Looking forward to it.
Travis, I appreciate you. Thank you all for continuing to stay with us. We really appreciate you all tapping in with us for our Barbershop Health Talk 2022. We've learned a lot, we've grown a lot, and we've worked through a lot. Gun violence is something that afflicts our community more than others. We unfortunately know it's going to happen again, but we know after this time with us, we'll be better prepared and better have more resources to work through it. So I want to give another shout out to our sponsor, GT Davis Health, our co-collaborators, Brother Be Well Project, Trap Medicine, Lula, List of Love Always, My Brother's Keeper Sacramento, everyone that's been involved, coming to you here from exclusive barbershops and here in Oak Park, Sacramento. Take care.
Well, thank you all for checking out our first episode this year. This is Carter Todd again. I was just on there. Man, heavy good stuff. We paused a little bit on premiering the episode just because of all of the gun violence that's been happening since that recording. So like we said, that was back in April. We had the killing in Uvalde at the elementary school. We had the shooting in Buffalo. Just numerous other shootings that have taken place in this country since we recorded that. So we were trying to be respectful to those who lost their lives and just respectful to the times, because it was heavy. As I watched that, that's my biggest takeaway, sitting there talking with Ryan Banks, and the fortitude he had to sit there and unhash some of that was not easy. That man, lost people that he knew. It happened right in his backyard, and I really appreciate him being able to come on and tell his story, give those words of encouragement, because it's important. It's important for people to see what it looks like to move through, to role model positive ways to get through these kind of violent acts. As I talked about, we recorded in April, so looking at some statistics, In May, there's been 63 more mass shootings, and in June, it's June 23rd, there's been another 19. So between those 2 months, there's only been 7 days where there hasn't been a mass shooting in this country, which is pretty incredible. And when you think about it, right, like why does this happen here? Does it happen everywhere? Is it specific just to us and our communities? Well, out of 178 countries around the globe, uh, who do you think has the highest rate of private gun ownership out of 178? Right here in the United States. So there's a lot of reasons and confounding factors as to why the gun violence is taking place. But we'll unhash some of that. Continue to talk about it in a Q&A right now. So I'll invite in some of our other Q&A panelists now. We'll see who's here. They're in the backstage. Dr. Brown, thank you. Thanks for joining us.
Hey, how you doing?
I'm okay. How are you today, sir?
I'm just getting through it, having a good day.
Are you at work?
I absolutely am at work.
Well, don't incriminate yourself if you're on the clock.
No, it's not like that. I'm good.
All right, very good. It's tough being the man. Well, thank you again. I haven't seen you since we recorded a little while ago, but what was it like for you recording the episode?
Oh, it was sort of a mixture of emotions. I think that the topic itself is pretty sobering, and it touches all of us. It has, unfortunately, been really highlighted by all the mass shootings that made it in the media. But I think sort of one of the things that is actually remarkable in kind of a bad way is how many shootings don't ever make the news around here, that we see come through our doors all the time. It's something that's always ongoing. And so I think that, it's nice to, bring voice to a lot of the experience that's going on, while at the same time it's a sobering topic. But I think that this is a way that we empower the community and get involved.
Yeah. Now I hear you there, right? Like the things that get publicized, we see a lot on TV, which rightfully so, but working in the healthcare system, you see it, like you said, one or two people a day, right, that are coming in. So it is very sobering. And I think there's a time where people are focused on it right now, and we can really sit back and understand, like, this is impacting all of us, right? Historically, right? We get the tag, oh, this is a black on black crime, or this is a black issue. No, this is an everybody issue. We're all in this.
Every community can be touched.
Mm-hmm.
Every community.
All right. So let me think. So what about your program? So the wraparound program, we talked about a little bit in the episode, but what are you all doing, and what's been like the biggest success of that wraparound program? If there's like one patient or one thing that stands out to you.
I think to me, each of the patients is a remarkable story. But I think what actually speaks to me a lot is the hospital experience and the experience after hospital, in the sense that we as surgeons have been, pretty good for a long time at managing gunshot wounds, as far as like getting in there and fixing the holes and doing a lot of things like that. But I think that the experience that our community is having coming to the hospital under those circumstances, has always been something that left some to be desired. And I think that now one of the things that the wraparound program has done is just really add a little bit of a human touch to everybody's experience, to what we as providers and healthcare workers see and bring to the table. I think that our eyes are a lot more clearly open now to the experience that our patients are having. And I think that our patients are hopefully coming through the whole situation with a much better experience in the hospital. It's a pretty traumatic event, obviously. When people come to see me, it's usually one of the worst days of their life, right? I mean, unless your name is Mrs. Brown, you probably don't want to wake up seeing my face. That being said, you come in the door, you're getting all your clothes ripped off, and everybody's coming in. It's a whole room full of people. You're under blackout. Nobody knows you're there. You can't communicate with anybody in the beginning part, and there's just a lack of information. And, you're going through that. And then, we have to build trust with the patients and their families after that. And that's always been a tough thing. And I think that now, that we got our eyes a little bit more open to the experience of the patients and the patient families, we are a lot more conscious about what we do to make that experience better. And I think that's one of the real um, victories of the wraparound program. I mean, that and empowering people, of course, to, change the course of their stories in positive ways, of their choosing. I think it's amazing what people will do when you line up resources in front of them, what they can accomplish. And I think that it just speaks to the importance of having those sort of resources available in the community and just making people aware and getting them connected with it.
I appreciate you shining a light on waking up in a hospital in that situation. I couldn't imagine, right? You're hurting, something very scary just happened to you, and now people are doing all these things to you, right? So I think it's important, right? Like you said, the human touch is it's humongous, right? Because the PTSD, the depression, right? The fallout that's going to be maybe physically, you're not going to be who you were before, right?
Absolutely.
And that's it's easy for me to say it's hard, and that's an understatement, right? It's life altering and life changing, but a program like yours gives people the opportunity to use it and trying to change the narrative, right, and position themselves to not be one of those statistics that come back into the hospital, right? When you talk about that statistic, it was in the 50-60% recidivism?
Yeah, at least 40%, some
At least
communities
40?
sometimes higher for the recidivism within the next 5 years, which is, I mean, it just really speaks to the fact that we have a lot further to go. I think that, we used to be okay with the outcome being survival, you know, and saying, oh, well, we got that person through that and sort of, and they're still alive today. But, we're better than that. And I think
Mhm.
that we should expect more from ourselves and be able to go beyond that and sort of help people get to the point where they're not coming back to see us for that problem,
Yes,
and
sir.
where their navigation through the system is not a painful experience. Like, we're seeing a lot of the issues, and we know that it's time for us to sort of expand what we're doing and get beyond what we originally thought was adequate. When you know better, you do better. You do the best you
Sure.
can till you know better, and when you know better, you do better. Well, we know better, so it's time for us to step up.
Yeah. Well, thank you, Dr. Brown. We're going to keep you on here as well. I think we have someone in the background. If Aaron could go ahead and bring them on. Dr. Atalo Brown. I got Brown, Brown to the
All
second power.
right.
Thank you very much.
All right.
How's it going
Uh,
now?
it's all right, man. We're just live Q&A here. We appreciate you. And that's the beautiful part about our Barbershop Health Talks is these gentlemen on the side will understand is that we are all off the cuff. We don't script very much. We just are having authentic dialogue, real conversation. I think that that's what people need. A lot of times it's a lot of things are rehearsed. A lot of things are kind of packaged in a certain way. And I think that to really reach folks and have people hear us, to get the education out there, it has to be real and authentic. So just like the episode, this conversation is going to be the same way. So Italo, I appreciate you being here, man. How you doing? Been a while.
Not bad, man. Just working, man. That's about it. Doing all the work.
So do you want to tell folks you didn't get a chance to be on our episode? He did pull up to the barbershop. I will let y'all know that he did pull up, and he was busy at a different conference. He was running around a mile a minute. So maybe tell the folks a little bit about who you are, trap medicine, and y'all's program there that's tremendously successful.
No problem. Dr. Italo Brown, emergency physician at Stanford, also social emergency medicine trained, and I do public health work. Now, in terms of trap medicine is a barbershop-based health initiative launched by my brother Jamil Lacey, who is now a rising third year at UCLA Drew. But in 2014, comes up with the idea of using barbershops as a safe space to have conversations around health and wellness, particularly because Black men and boys are a hard-to-reach subpopulation, and coming from the same communities, we're able to use that capital that the barbershop has to have these conversations that shouldn't be taboo at all at this point. But we see the clear health disparities that exist in how Black men and even Black boys are affected. So this is our push to try to address that.
Nice. It makes me think Travis Nelson on the talk, he was talking about the way that we see ourselves, right, in the community, and that misinterpretation of another person's demeanor walking around the grocery store and the club, wherever it may be. So, in trap medicine, what's been the success of reaching people and having these good conversations? What are some of the programs that y'all have done to make that trust there and to help people break down some of those rigid barriers?
I think the most, I guess, obvious or outer tier of success is essentially just repurposing a space that has been very familiar to us for years. You know, the barbershop is like the black men's country club. So repurposing that space in a way to have conversation that is very vulnerable. The second level of success has been actually seeing outcomes shift. Everything from the work throughout COVID, where we've been doing a variety of different screenings, vaccinations on site in Los Angeles, extending even into doing preventative care and screenings outside of just viral nature. For example, we partnered with Cottonelle to do it was called, down there, it was a check or a screening test that they were given and it can do at home. And so were able to dispatch probably around 5,000 of those. So it's really just been through partnerships and identifying these like common desires for organizations and using this space to kind of get those things across. And I think that the last core part has been seeing the way that young black men interact with physicians for the first time, right? Them seeing black doctors, seeing black clinicians in that space, and being able to relate to them in a different way. So all of these things help to build trust in communities, help to dismantle some of the distrust that's built over years, and really reinforces the idea that we have ownership over our health.
Nice. Well, you guys are doing great work, man. I've seen trap medicine probably in y'all's first year, and I feel like every year you guys stay busy. You're doing more and more. Jamil he's a powerhouse, man. I don't know how he does it all.
I told him he probably got a clone. He's got to have a clone.
Yeah, he is powerful. So while we're here, in Sacramento specifically, what are some things? So obviously we're each doing in our own spheres, right? But what could we do as a group, right? Let's just brainstorm. What are some either projects or platforms that you've seen work elsewhere, and maybe think about like, how can we do something here in Sacramento? What could work here on the West Coast? Either one of you.
I would say one of the most important things is, I think, getting the sort of increasing the involvement of the hospital system with the community. I think getting a bigger, better tie-in and buy-in of the hospital system, saying we are the greater community, rather than like having it just be this building that's in the center of the community, making it be more of a part. I think that that's really important. I think that, it'd be interesting to see if people are meeting the trauma doctors outside of the trauma bay, for example. You know what I mean? Like, we're going to the schools, or we're going to whatever, and people, that helps in a couple ways. One, you're educating the community, getting people involved and feeling like there's buy-in both ways. And then two, I think that it gives people a pathway, let people know that actually, if this is something that's part of their own ambition, there is a pathway to get there. Because I think a lot of us came through without a lot of trailblazers in front of us. We had what we had, and we had to kind of like really grab on that. And I'm grateful for the ones who were there, but I think that it's not as easy as it might be. And so I think that community involvement is probably a great start.
I'll just kind of like ducktail off of that. I think another part is just consistency, right? We have a bunch of different folks doing things in silos, and it's good work, right? But having the collaborations and the cross partnerships and consistent engagement is where most of the time the initiatives fail. So making sure that those faces are there consistently, that it's not like parachuting into communities, and it's people who literally come from these same exact neighborhoods and who have spent time with them, know the family members, went to churches in these communities, and still, have people who live there, if not living in those communities themselves. Like, that creates authenticity. And again, as I said, it just amplifies the work that's being done because the buy-in is visible.
Yeah.
Yeah, if there's no consistency, it doesn't feel real. I would agree. Yeah,
We've
absolutely.
seen that a lot, right, over the last couple of years since the murder of George Floyd, right? How many people were enlightened, right, to a whole issue that we already knew about, and then you look back and are the same people at the table, are the same conversations happening, right?
Right. You
You
can't
know,
show up for the photo op, you know?
exactly. We got to be there,
Yeah.
and
Right,
that's a big
right.
part of it. I will say, Atalo, I don't know if you know, but Stanford actually chartered a local chapter of the National Black Nurses Association last year. So they have a chapter.
Good for them.
Yeah, I know they have a chapter of Black nurses through. I believe it's a part of Stanford Health. So that's pretty cool because they got a Bay Area chapter, and then they got one over there on the peninsula as well.
Long overdue, in my opinion.
Yeah. So shout out Stanford, right? That's one way. Ian, you was talking about how do we get the system to be more ingrained in the community. Well, shoot, invest in the community partners, invest in the community programs that's already there.
I would even
I'm glad
extend
to
that
hear
one
about
step further.
Stanford. That's my people too from back in the day. That's
Right.
where
I
I
was
grew
gonna
up.
say I know there's your people too. I'll extend it one step further. I also think that we have to do a better job of supporting community health workers. Right. It's one thing to say people who are already woven into the ecosystem of a healthcare system, but there are community health workers who never get the shine, never get the
Yep.
flowers. They've been doing this work for years and have more on the ground experience and knowledge of resources than most clinicians do. Right.
Yeah.
Like we lean heavily on our social workers, our case managers, but these community health workers understand neighborhoods a little bit differently. And if we could find a way to continue to, encompass or rather wrap them into the work that we do, that would be excellent.
Yeah.
And support them financially.
I will say, just to build off of that, one of the things that's been going on in this country around gun violence is that, like, you have a lot of voices that are sort of leading the charge, but that is the voice that we've needed to elevate for a long time. There's a national organization called the HAVI, which is a group of hospital-based violence intervention programs and community-based workers who are working to sort of elevate that voice and get it at the forefront. Because if it's other groups, like other stakeholders like the surgeons or whatever, driving the conversation, you're missing some really important data, some really important insight, and some perspective. And so nowadays, I think that we're sort of opening the doors and opening the ears of people to sort of hear all the relevant voices and understand the importance of the roles. So.
Yeah, community health workers, right? Imagine having someone being able to link up with someone in their neighborhood. If not, I've envisioned that with the community health workers, right? In every neighborhood, there's a couple of people, right? You can't all have a doctor and nurse in every neighborhood, but what about a couple people who are very fluent in getting the resources for food security? People who are very knowledgeable around their diabetes, around their hypertension, around their different types of cancer screenings. And going back to that, really like the community, right? And being able to tap into folks. We go and ask people for some sugar. We go and ask them for their screwdriver. Well, hey, what about my diabetes? This is 270. Is that a good number? I don't know, right? And then, like you said, also, Atala, making sure that they're compensated. I think a lot of times because we went to school and we passed one test or handful of tests that we automatically ascend in this financial space, but we know that the healthcare system is making a ton of money. Every hospital and that I've seen is adding on, right? No one's reducing in size; they're all growing. So making sure that we lump in these valuable people in the community who really can do the work and make sure that it lands. Because so many times we create a good program or create a good intervention, but if it doesn't hit and stick, it's going to go away, right? And we know that.
There's 1,000 examples of community-centered programs that have failed. And a lot of times it's because of the lack of credibility. I've watched Stop the Bleed programs brought into different communities and they fail. And then you see, Miss Johnson from such and such church start doing the work and then people listen. And it's because these individuals who are already embedded in these communities have a different level of credibility. And we have to elevate that. It's currency that most clinicians do not naturally have unless they came from the community and have been doing the work through the body of their career. So,
yep. Well, I appreciate y'all's time so far. I'm going to ask Aaron. He's in the background. Is there any questions on on any of the chats? Aaron, he just woke up. He's night shift, so I know he don't want to jump on here. Do I have any personal experience involving gun violence? I appreciate that question. and I will be candid because we are live. It's a situation that A, I shouldn't have been in myself, and B, that I don't like to think about and bring up because it was very traumatic, right? But I was in a wrong place, wrong time. Well, I was in the right place because I thought I should have been there, but definitely the wrong time. And I did get a gun pulled on me and put to the back of my head, right? And in that moment, I realized how defenseless we all really are to guns, and how, people that use those guns in those ways, there's nothing that we can do to fight it. And that's why, for me, losing friends to gun violence, I've had a couple friends who have passed away in their early 20s to gun violence. It's something that I'm passionate about. It's something that I know impacts a lot of the Black community. Hearing Ryan talk, and I'm getting a little worked up just thinking about it, because it's something that just isn't fair, right? For me, it's just not fair. It doesn't create an equal playing ground, and that was my experience. It's something that it did. It shook me to my core. I was very fortunate to get out of that situation by the skin of my teeth. So that's my little story. So yes, I've been involved in gun violence intimately. I've never been shot myself, very fortunately, but I have been a victim of it in a different way. What about y'all?
Yeah. Yeah, I can list off a couple of names going back from high school and up through even more currently. A lot of friends, not a lot, but a number of friends and that we've lost over the years. I think actually on both sides of it. I can also think of some family that have been on the other side of the gun too, that we lost in a different way because they end up in the system on the wrong side of things. And I remember one time, I think there's some kids playing around shooting when I was outside once, which was a really terrifying event. Probably not as up close and personal as the one you described, but nevertheless, I was pretty terrified myself. But yeah, I think that yeah, definitely.
From here. That's all I'm saying. I'm from Sac.
Yeah.
Cal State Fair almost annually growing up.
Yeah.
Skating rinks, high school football games. This was not an uncommon thing for me.
And think about it. That's the norm, right? So
Right.
We talk about Maslow's hierarchy, feeling safe in any environment. Having to go to school and not feel safe, being worried about what someone has tucked on their waistband, saying something, which high schoolers do, young people, they're going to pop off at the mouth, right? That's what happens. But then being worried when someone goes to the trunk that your life could end just like that is pretty remarkable. And that's what I'm saying. Gun violence, it escalates and elevates any situation into a place that it doesn't necessarily need to be. You know what I'm saying? I'm not saying that people should live a utopia life where there's never going to be confrontation. There's always going to be confrontation. But to lose someone's life and take someone's life, like you said, Ian, right? The ripple effect and the fallout from that is something that we need to continue to work on in this country. There's a lot of ways to try to cut it to solve the problems. I know that both of y'all are doing it in your own rings to, either acutely or the bigger picture try to impact it. So I appreciate both of y'all. Dr. Ian Brown, you answered the phone. I do appreciate you, man, and I've seen you in action in the hospital. I know the work that you do, and I highly respect it. Dr. Italo Brown, I do appreciate you as well, sir. He is continually giving back in a lot of different ways. He's a very busy man. I think it's important to have as many Black male physicians leading the charge and giving their voice to this healthcare that we all experience. Any last closing words, or are we going to get up out of here? Y'all want to plug anybody, any IG handles, any programs that you want to talk about before we leave?
I just say, look up trap medicine, look up the wraparound hospital-based violence intervention program. If you're interested in violence intervention programs, the HAVI, just Google the HAVI, HAVI. That's the national organization. You find out a lot of how to get a program started and sort of what are the key stakeholders and what do you need to get something like that going.
I just want to say a big shout out to the Capital City Black Nurses Association. You guys are doing amazing work and being the anchor of all of these things. So continue to lead from the front.
Absolutely.
All right, y'all, we're going to get up out of here. Thank you very much for your time, and we will check in with y'all next time.